The time where a bystander can intervene and make a huge difference is usually before EMS arrival. Now, that's not to say they're not useful in certain situations and that we won't utilize them when we're resource limited, but most of the time it's, I don't need you hovering over this patient. I don't need you giving me your advice. I don't care that you're a podiatrist and that you think he's got an ingrown toenail. And you laugh, but it's true. And that has happened to us on scene. So, everybody,
No
oh
way.
man, my wife's a paramedic, so I think I can help you in this situation. Or,
Oh,
I saw a podcast that said I should do this. So like just being able to kind of back up, and not make things worse, patients, sometimes there's a really calming presence, especially with, an autistic individual that might be a patient or somebody that's, emotionally vulnerable in some way. Sometimes you can have somebody that's really a calming presence for them. I'll give you a hint though. It's never the person that's crowding over their head crying. That's never helping the situation. So just remaining calm, backing up, and then helping where they are directed to do so, and just kind of not doing anything else in that situation. Like I said, the time for them to help is before we get there.
yeah, because it's always that thing of like, no, 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 he looks like I've seen this, I could do that, and it's like you're just making it worse. But they mean well, but I think that's the thing is we all want to help, but like you were saying earlier about it's the specialist skills. It's you want to get that person in, you want to stay out of the way, help if they ask for it, but stay back and then leave as directed. Nowadays, you see people taking their phones out. They want to, I'm going to put this on Instagram, and it's almost like we've forgotten how to be a community sometimes, and helping each other and stuff. But so
That's
when
phones are awful for us. And like number one, it completely derails my psyche. Like I'm used to it at this point. We can work through it. It's not like it's going to just wreck everything, but you know I get pretty upset with that, where you have somebody that's having the worst day of their life. And it might be like a really crazy situation. It might be something that you think you can get some views on TikTok or on Instagram. But having a bunch of phones in your face when you're trying to perform as a professional, when somebody's having, a human being, a member of your community is having a horrible day, is probably,
Hmm.
if they're okay enough where they're conscious, it's probably embarrassing. If they're unconscious, like, can you imagine if their daughter or their wife sees that pop up on social media when their, dad is now, or relative is now a quadriplegic from this accident? Can you imagine how triggering that would be for them if they see this pop up on a social
No.
media site, or on, World Star Hip Hop or something, like, one of these horrible sites. So I guess I would just encourage people to be respectful. Uh, you know, a phone is not helping anybody. It is really not helping anybody when it comes to emergency medical care, and people getting what they need to have done.
Because it scares me that like that's a lot of people's reactions is I'm going to take a photo of this, I'm going to record this, rather than okay, how can I help? That somebody's hurting there. Like you would want somebody to help you if it was your family. Like, but why? It's probably a whole podcast in its own of why people have gotten to that point. Probably it'll probably drive us crazy just talking about it. But it's like so once you've gone to a scene and you've dealt with this, I was always keen on like debriefing to get better. You know what I mean?